Hi, I'm Miriam Cates. I'm the Member of Parliament for Penistone and Stocksbridge. Lots of people have been sending in queries about the vaccine, so I thought I'd try and answer some of the most frequently asked questions. So firstly, why do we need a vaccine? Well, anyone who isn't immune to coronavirus is at risk of catching it. And for most of us, coronavirus is not a particularly dangerous disease, but of course, we can all pass it on to someone for whom it is very dangerous. So the more people are immune, the less chance there is of the disease being passed on. Now, there are two ways of becoming immune to coronavirus. If you had the virus, then you have antibodies to it and you're immune to it. Or you can become artificially immune to the virus by having a vaccine. So vaccination creates artificial immunity. You become immune to coronavirus without actually getting ill. Now, at the moment, so many people in the UK have got coronavirus. A proportion of those people are becoming very unwell and having to be hospitalised. And many, of course, are sadly dying as a result of that infection. And it's becoming increasingly difficult for the NHS, for our hospitals, to cope with the number of people who are being admitted with coronavirus. So if we vaccinate large numbers of people who are at risk of becoming seriously ill or dying from COVID, then not only are we protecting them as individuals, but we're also reducing the pressure on our hospitals. So vaccinating people against coronavirus is incredibly important, not just for individuals who are at risk, but for our entire healthcare system and so for our whole society. What's the rollout strategy for the vaccine? Well, the vaccination is being given to people in order of clinical priority. So that means starting with the people who are most likely to become seriously ill. And because it's a disease that primarily affects elderly people, we're starting with the very oldest people and those who care for them. So there are 9 categories of people who have been identified in terms of the priority list. And you can see that and more explanation of that on my website. So at the top of the list are the very oldest, the most vulnerable, so residents who are in care homes. And the evidence suggests that if we vaccinate just 20 people in care homes, we'll prevent 1 death. So it's so important to vaccinate this group of people, and that's why we're starting with care homes. And then we're going on to the second group, which is everybody aged 80 and over. And again, the evidence suggests that if you do 160 vaccinations in that age group, you save a life. So again, very important to roll out the vaccinations to those groups. And then we can go down the list as we go through people who become less and less at risk of becoming seriously ill. And actually, if you go all the way down to the rest of the population, so let's say people who are under 50 and don't have any underlying health conditions, you'd actually need to give 47,000 vaccines to save 1 life. So you can see just how important it is to roll out the vaccination to those people who are most at risk. So the oldest people in society and people who have underlying health conditions. So the strategy is very much to protect those first who are most at risk of serious illness and hospitalisation, because that's how we will bring down the hospitalisations and the death rates as quickly as we possibly can using the vaccination. Some people are asking why they haven't heard from their GP yet. So it may be that you or somebody you know is in one of the highest priority categories, but hasn't been invited for a vaccination yet. Now, I've been speaking to GP practices and the clinical commissioning groups and vaccination centres across Penistone and Stocksbridge, and I know that they are all very much following the priority list. But of course, each GP practice will have different number of patients in all the at-risk groups. They'll receive different deliveries of vaccines at different rates and different times. Some practices will group together to improve the efficiency of rollout. So there are big differences between different practices, between different areas, and there are huge logistical challenges. So please be patient and wait to be contacted. But please be reassured that all our primary care groups are following the prioritisation list to the best of their ability. But if you're not registered with the GP practice, then you should very much register. But other than that, please don't contact your practice and ask when you're going to be vaccinated. They will contact you when they get to your priority group. Will the vaccine still be effective with an increased delay between the doses? So coronavirus vaccine, like other vaccines that we know, so particularly some of the ones that we're used to receiving in childhood, is a 2-dose vaccine. So you have 1 jab and then sometime later you have a 2nd dose of the same vaccine. So the most benefit comes from the first jab. The majority of the immunity is gained that first time, but the second jab is a booster that will give you long-term immunity. So immunity to coronavirus that hopefully lasts more than months and then potentially could last a lot longer than that. So the trials for the coronavirus vaccines were done with a 3-week delay between the first and the second vaccine. But given the huge current pressure on hospitals as a result of this new strain of COVID that's being passed around so much more quickly, the priority has to be to get as many people vaccinated as possible to turn the tide of the pandemic. So it's much better to vaccinate 100% of our over 80-year-olds than to have 50% of them having had both doses and 50% of them having no doses, and so being completely unprotected against the disease. So given that the second dose is mainly to ensure long-term immunity, so the short-term immunity is covered by the first jab, the evidence suggests that the second dose can be delayed and that waiting longer than 3 weeks doesn't really make any difference to the long-term immunity as long as the second dose is received within 12 weeks of the first. So that's why the decision has been made to delay the second jab, so that we can get as many people as possible vaccinated and therefore immune, protect as many people who are at risk as we possibly can, as quickly as we possibly can. What's the difference between the different vaccinations currently being delivered? Okay, so at the moment we've got 2 vaccinations being delivered in the UK, the Pfizer vaccine and the AstraZeneca or Oxford vaccine. They're both highly effective. They've both been fully tested. Every batch of vaccine is tested before it's rolled out. The Pfizer vaccine, it has to be stored at incredibly low temperatures, so much lower temperature than a standard freezer, and very few places have got the facilities to do this. So we're talking universities, hospitals, but not GP practices and pharmacies. And once it's been defrosted, the Pfizer vaccine has to be transported and used pretty quickly. It has to be mixed with saline solution and delivered to the patient within 6 hours. So it's quite logistically challenging to deliver, but it was the first one that came on stream. So of course we've been getting it out as quick as we possibly can. And there's another one, the Moderna vaccine, which is a similar one that has just been announced that it's approved today. Then we also have the AstraZeneca or the Oxford vaccine, and that's much more like the flu vaccine in the way that it's delivered. So it can be stored in a fridge. It's easier to give out to patient. It can be done in normal clinics and normal GP practices. And that's why we're ramping up the production of this one, because it's so much more easy to get out to patients, and it will be able to be delivered by more centres. So both are highly effective vaccines. There'll no doubt be other ones that come on stream too, but they're just different in the way that they have been produced and therefore in the way that they are stored and delivered. Will the vaccine work against the new strains of coronavirus? So a virus is a long piece of DNA code. It's a bit like a recipe. And every time the virus replicates itself inside the cells of an infected person, this code is copied. And sometimes a mistake is made, and that's called a mutation. It's basically a slightly different version of the recipe, a slightly different version of the virus. And the way that human immunity works is that it's very specific. So you have different antibodies that match or fight different diseases. So if the virus becomes too different, then your existing antibodies that might have fought the virus in the past won't recognise the new version. And so that's why we have a new flu jab every year, because the flu virus mutates a lot, so much so that we need a new version of the vaccine each year. But so far, the evidence suggests that the new COVID strains are different to the original virus, but not different enough to stop the vaccine working. So that's fantastic news, because it means that the vaccines that we are rolling out right now will protect, as far as we know, against the new strains as well as the original ones. Of course, this may not always be the case in the future, but the amazing thing about the new vaccine technology that's been used to produce the Pfizer and the Moderna vaccines particularly is that it's relatively straightforward to adjust the vaccine very quickly. So we could do that if there were mutations that meant we had to do that. So it could be the case in future years that we have a yearly coronavirus, just like a yearly flu virus, where we address different mutations each year. But the goal is, of course, to get the vaccine out as quickly as possible, starting with the most at-risk groups, but getting to the point where we've got herd immunity across the population so we can dramatically reduce the transmission of the virus and of course the amount of people becoming ill, hospitalised and sadly those who are dying from the disease. So I just want to say thank you so much to our incredible teams of primary care, GPs and all their staff across the constituency. They're doing an incredible job, working so hard to get people booked in for clinics, to work against the clock to get the vaccines out. So I really, really appreciate everything that they're doing. And as I said before, please be patient, please wait to be contacted. Don't overwhelm GPs with contacting them right now.